for coming. This evening we're reporting to you that we have diagnosed 54 new cases of COVID-19 in Ireland today, bringing our total to 223. 30 of these new cases are male, 24 are female, 41 of them are from the east of the country, 11 from the south of the country and 2 from the northwest. And we still, in total, have experienced 2 deaths in this country. Across the world, 168,019 cases have been diagnosed with 6,610 deaths across 148 countries. In Italy, we've seen 24,747 cases, Spain 7,753, France 5,923, Germany 4,838, and the UK 1,543. We've been doing some work in relation to our modelling data. It's an early modelling prediction that we're making, and at the moment we're just giving a prediction that goes forward by a number of days, and we expect to see the number of cases continuing to rise. We've made that clear, and this does not mean and will not mean that the measures that we've put in place, the recommendations that we've given to the public around their personal behaviour, the social distancing measures that we have mandated and recommended are not working. We expect to see the cases continue, and our model is telling us to expect we might have something in the region of 78 cases tomorrow, 109 cases on Wednesday, rising to a daily number of 355 cases by Sunday of this week. So a continued pattern of exponential growth. That would bring us to 1,300 or slightly over by the end of the week. And we would estimate that that would involve somewhere in the region of 40,000 close contacts for those cases, giving you some sense of the scale of the work that has to take place, albeit that we're at an early stage in the increase in the number of cases that we expect to see. To share some other data with you, we've had some research done by Amórach from today involving a sample of 1,460 adults. Where we can reveal that 90% of people say they're washing their hands. 84% of people know the 3 most important symptoms in relation to COVID-19. 78% of people say that they are staying at home. 45% of people say that they have started to work from home. But 54% of people report that they're sitting further apart in relation to our social distancing. And so maybe more work for us to do there in helping to get that message across. And people are reporting that they are more worried than the same measurement we had last week. And 90% of people are telling us that they're confident that in the event that they get sick, they have someone to look after them. And just a couple of things to highlight from today. The Cabinet Committee met, and you'll be aware that they were briefed by us in relation to our assessment of the disease, where we are, the ongoing modelling work that we're doing, and also approved the action plan, the cross-government action plan, which I believe has been published now and made available to you. We had a meeting of the National Public Health Emergency Team. The letter that captures the recommendations and decisions that were recorded by the National Public Health Emergency Team has been published and will be made available to you. But if I might just highlight in some specific recommendations in relation to travel, we've advised, and it's been accepted and communicated, that all Irish residents be advised against non-essential travel overseas at this time until the end of the 29th of March. That all persons coming back into the country, including Irish residents, should restrict their movements for 14 days if they are asymptomatic. This does not apply to Northern Ireland, and this measure and recommendation applies prospectively. And we also provided some advice and guidance on restricted movement, and that it would not apply to workers in the essential supply chains. And we're working with the Department of Transport, the stakeholders involved, to ensure that we make guidance available to those sectors, and we intend to publish that this evening. So those are the main highlights from today. We're happy to take any questions that you might have.
Sorry, Tony. Shane Beattie from News Talk. I'm just going through your projections there. By the 29th of March, you're looking at maybe 10,000 cases potentially in this country. I don't know exactly, but certainly you're into the thousands there. how realistic is it that we're saying to people that if you comply with the measures, if we close the schools, if we close the pubs, that we will be back to any sort of normality by the 29th of March based on those figures?
So we're expecting to see exponential growth. The reason I'm just giving you figures up to next Sunday is we're at an early stage in the model. The further forward you go in time, the less certain and precise some of these estimates will be. I couldn't dispute the figure that you're giving in an approximate sense by around that time. And we don't necessarily anticipate that we'll be in a situation by the 29th of March. We really do not anticipate that we'll be saying that we're going back to normal at that point. We expect to be up to and through that time period to be experiencing significant growth of this kind of order in the numbers of cases being picked up. Sorry.
Tony, we've seen community testing being ramped up now. Is there any indication of, say, when somebody contacts their GP and they make a referral through the system, how long on average it might take somebody first to get the appointment for their test, and then how long it might take to get the results of that? With regards to the cases, the 223, is there a broad outline that you can give us, say, that without going into too much details about person, but say we have patients between their 20s to their 90s? Because I think and I know in the media we're saying a lot of the time it's older people are more at risk, those with underlying health conditions. But if there are younger people and they hear that they too can be impacted, it might just make a bit of a difference, if you could answer that.
Sure.
I'll take the question on the testing. Yes, we expect a big surge in demand for testing after the case definition was changed last week, and in line with the WHO's recommendations to test all suspect cases. So we've worked quite closely with the ICGP over the weekend in setting up this pathway, in urging people not to phone 999 or out of hours, because those are two important numbers for emergency services, urgent care for GPs. In the meantime, we're building up capacity at record speed to respond to the anticipated need for increased testing. So in the meantime, I'll come to in regard to your question, we do need to build up the pathway. That requires increased testing capacity. We have 19 new centres identified. That will expand to 34 by the end of the week. We need to identify testing equipment. We have a limited amount. We're getting another large shipment in on Thursday. In the meantime, the message to people is we understand your concern. Phone your GP, who will screen will listen to you and listen to your history and decide whether or not a test is appropriate. In the meantime, self-isolate. The test will happen, and when you have the test, if it's negative, theory that would be a reassurance that it's some other viral illness or cold, and if it's positive, you go along that pathway. So, and finally, we are obviously having to expand rapidly the lab capacity beyond the NVRL to now 7 hospital sites to accommodate this testing. So it's a surge in demand based on the case definition, and we have to rapidly build up capacity among, not just in terms of the pathway, but in terms of our testing capacity and in terms of lab capacity. It's certainly going to be a matter of days, and it may be longer, but in the meantime, the message to people is to be patient, to self-isolate and to wait.
If I might just add to that the WHO has again reiterated and made clear its advice in relation to testing. They're saying test, test, test. To continue testing as many cases as possible. That remains our strategy, to encourage people to come forward, to be patient, as Dr. Henry has said. But getting people tested is a key priority for us in each case, but self-isolating in the event of symptoms from the start in any case. Dr. Glynn is going to address the other question you asked.
So obviously we've said that we're going to present much more detailed data as the numbers build up and as we can become more assured that what we're giving is in an anonymised form. But what I can say to you in relation to approximately the first 155 cases is that 1/3, so 33%, are aged between 25 and 44 years.
Can I ask Dr. Tony Houlihan, please? Well, 2 questions really. One, I think you probably have projections as to where things are likely to go by the end of this week. Can you tell me what those figures are? And then also, what advice do you have in relation to indoor gatherings and supermarkets?
So in relation to the first of those, the modelling data that we have is at an early stage. We're not going to project beyond the end of about this week, but what we expect to see arising from it is by tomorrow an extra 78 cases, by Wednesday an extra 109 rising to a daily total of 355 by Sunday of this week. And we expect to see it continue to grow after that point, but the precision of numbers, I'm taking you as far as next Sunday, 355 cases. In relation to indoor mass gatherings, we've made clear that we think that mass gatherings over 100 indoors are things that should not take place. We do not regard supermarkets as indoor mass gatherings. Supermarkets provide and need to provide an essential public service and a support to people, and it's important that people continue to be able to use supermarkets. I am aware that questions have arisen and that supermarkets have questions that they may wish to ask. I just want to make clear we have made the guidance available since it was approved on Thursday of last week, and we're anxious to work with any sector to help to interpret what that guidance might mean for those sectors. We haven't changed or updated that advice or guidance, and that's still the position in relation to social distancing. And if the retail sector is in a position where it wishes to have engagement with us around those kinds of questions, we're ready, willing and able to do that in the way that we did yesterday with the bars and pubs.
Tony, just wondering, do you have any figures for people who've recovered from this yet?
So in reference to the report that Dr. Glynn mentioned earlier on, we'll set out some of that data, what our collective experience has been as a country with cases, mild, moderate, severe, recovery and so on. We're not in a position to set that data out this evening.
Hi Tony, I just want to ask you, Keir Phelan here from the Irish Mirror. There was a doctor that tweeted out earlier on today, he's well known within the media, he's unable to get any patient tested for about 6 days. GPs are having struggles to try and get their patients tested. Can you talk to us about that? GPs are obviously struggling. Is the HSE struggling at this point?
Well, as I answered your colleague there, yes, it's a huge challenge for us to ramp up the testing to the scale to respond to the surge in requests as a result of the change case definition and in response to the WHO's advice to test on suspect cases. We are working hard. We're working with the GP community, with the Irish College of General Practitioners to ensure that they can get rapid access to testing through HealthLink. But in the meantime, we have to build up our lab capacity. We have to build up a new number of centres. We have 19 up and running from none last week. We'll have 34 by the end of the week. This is an enormous operation in itself, apart from all the other activities and all the other plans we're putting together at in this time of unprecedented crisis. So it is hard to ask people to be patient when they're worried, but our advice remains the same. If you think you have symptoms of the virus, phone your GP. The GP will decide whether or not the test is appropriate. In the meantime, self-isolate and wait, and we will get round to you, but it will be a matter of days as we get testing kits in, as we build up lab capacity, and as we get these testing centres operational. To go back to the question of your colleague, how many days will it take? I can't say. We're working very hard to respond to the huge increase in demand for tests, and in the meantime, as I say, people, please self-isolate.
Just to go to yourself, Colm Henry again, am I repeating here to say that there's a limited number of testing kits and they were to expect more at the weekend? How many testing kits have we left and are we running out?
We have a limited number of tests. We're getting a large shipment in on Thursday, and that will help us accommodate the surge we've seen over the weekend and the requests we're getting in during this week. And we're actively seeking through our procurement, as well as personal protective equipment and everything else we need, we're actively seeking as many testing kits we can get.
And do you expect, though, that we might run out of these before we get the shipment on Thursday?
We're not countenancing running out at all. As I say, our priority is to identify everybody who needs testing, and our aim is to test as many people as possible. As I said to you, we have a limited number of kits. We're securing a large shipment on Thursday, and we're actively seeking further kits to respond to the unprecedented demands following on the change in case definition and the WHO advice.
And finally, one last question. The HSE are advising patients to contact their GPs. Now, I have a number of people that have contacted me and their GPs are actually charging them €45 over the phone to talk about their symptoms. What's the story with GPs charging them? Can you give any explanation on that, or are you calling for GPs not to charge their patients over the phone to discuss symptoms?
So I know that one of the measures that we want to try to do is to try and recognise, if you like, the impact that this has had on general practice. They've been at the front line of this since the beginning. They've done an extraordinary job, and in particular over recent days, as Dr. Henry has said, in relation to contact and contact tracing. We do not want to see financial barriers in the way of individuals who are seeking the advice and guidance of GPs in this situation. This is a public health emergency, and that's what it's been declared at a global level and in this country. We want to ensure that people are able to access the health services that we're advising them to access without impediments. We want to try and provide as much support to GPs as possible to enable them to provide the service that we want them to provide, which, as I say, they've been providing heroically since the beginning of all of this, and in particular in recent days as the situation has changed. We do not want any impediments in place in relation to individuals seeking access to services, and the charging of fees and so on would be one such impediment.
And sorry, I'll actually just follow up on that. Can you outline in more detail then the measures that might be taken to alleviate the requirement for these fees? Are we talking about cash transfers to GPs replacing payments from individuals?
There's discussion and there's engagement going on with the representative bodies at the moment in relation to some of the issues around this and what kind of support general practice will need. What I can tell you is that there's a willingness and a recognition on the part of government to support general practice and to ensure that general practice is in a position to respond in the way that we want. And I'm not in a position to outline the details of that now, but that's under active discussion and engagement and negotiation and discussion with the representative bodies.
And thanks very much. You mentioned some data from the model that's emerging. Is your model telling you anything about the kind of the latent cases in the community that may not be diagnosed and the level which there may be out there?
What our focus in terms of testing at the moment and detection is to try and detect as many as possible. I can't honestly tell you that I believe that we're picking up every case that exists in the community. We know some cases are likely to arise but that aren't picked up, maybe very mild infection and so on that doesn't result in health-seeking behaviour and so on. We can't measure the quantity of that from the model that we have. What the model allows us to do is to project forward the growth in cases that we expect to see. That's a crude, if you like, estimate at this point in time. As we get more cases, as we get more contacts and feed them into the model, it'll be richer and it will allow us to make better predictions about the age breakdown and what we're likely to see by way of age group, to see what the kind of utilisation patterns are likely to be in terms of either health service utilisation or other such things. But we're at too early a stage to be able to say, to answer some of the questions that apparently have been answered in other jurisdictions around things like peak, scale, volume and so on.
Then in terms of richer data coming out, I think you mentioned on Saturday that there was a desire to publish county by county figures. Yeah. I think this week, is that still the case?
That's still our position, and as I said earlier on, we're going to produce a more detailed surveillance report, and this is what Dr. Glynn was referring to, that would provide that kind of breakdown, much more detailed breakdown, and we'd have that on a weekly basis.
Sorry, doctors, you may have answered this, but out of the 223, can you tell us how many are in ICU, how many are in hospital, and how many are at home? And from when do you expect, or is there a day or a date or a number when you expect to see the measures that already have been put in place with the schools closures and the mass gatherings, that's working?
Well, it's certainly on the latter question too early to say and too early to expect that it could be working. If you like, just given the period of infectivity and the incubation periods, what's known about the virus and the averages and so on, these measures are in place since Friday of last week, which is 4 days ago. The majority of infections, if you like, that occur and result in clinical symptoms in the coming days are likely to reflect a pattern before these measures were instituted. And so we'll be looking, though, to see an effect in the coming weeks, which is not to say that like we think we can flatten the curve or get to a peak of a curve within the coming weeks, but we'd like to think that we could see an impact of the significant social and economic measures that are in place now. We'll know that on a continuing basis when we start to compare the number of cases against the experience that we're expecting to see and that we're projecting in the kinds of numbers that I've shared with you there a second ago, the numbers that we'd see over the course of the coming days. As we get further into it, our predictions and projections forward will be more stable. We'll be able to make predictions and projections for longer periods of time. That will help us to answer the question that you're asking. Are we seeing an impact of the measures? How big is it? What is that? How long will it continue for? And so on.
ITU, we haven't got complete data on all the numbers so far, but my latest number was we had 6 patients in ITU setting. Yeah. I can't answer.
So we'll give all that breakdown. As I say, what we'd like to do is to have what we call a surveillance report, which will have rich detail, and we'll break things down by age, by sex, by county, hospitalisation status, and so on. All that kind of, and we'll do that on a weekly basis. That'll be a publication, if you like.
So you expect 40,000 contacts by the weekend. You're going to have to trace. How many people have you got to do this work? And also, have you done any analysis of what the strike rate is? I mean, how many, in the cases that we've had so far, have you managed to contact, what percentage of contacts have you managed to get in touch with, and how successful is it turning out to be?
Yeah, on the contact tracing, there's different stages to it, Paul. First of all, there's the traditional model for this would have been carried out by public health consultants, and clearly with such an unprecedented challenge in terms of numbers, we have to rapidly change the model. So we're enhancing the support in the east and the south of the public health departments by setting up hubs of surveillance, which will be led by healthcare professionals, and enhanced support from trained civilians, including army personnel, as you saw, who will carry out the contact tracing. So we've greatly enhanced this in terms of numbers. We hope by the end of the week to have 200 additional healthcare professionals supporting the public health departments in their surveillance work. As Tony says, this is the bulwark of our defence against this virus: is surveillance, contact tracing, and follow-up and isolation. So, in addition to those 200 healthcare professionals, we will hoping to bring in an additional 500 administrators in terms of support to the public health departments to carry out this critical work.
Do you have have you done any work to analyse the cases so far, how successful that has been in terms of contacting,
Well, the civilians, as you saw from the army personnel, only came in last Friday, so they're actively doing their contact tracing work now. How successful that is in terms of tracing, I can't tell you, but we can provide you with details.
Just one other question. There are private firms out there like Randox who claim to have 15-minute tests and so on. Are you talking to these people? And are these runners as viable, quick tests that could be spread out among the community?
So yes, we're giving consideration to any of these kinds of questions, and most of this work is being done through the National Virus Reference Laboratory, and if there are any candidate measures like that, they'll be considered by our expert advisory group and the National Virus Reference Laboratory. There are discussions going on around expanding capacity into some of the private laboratories. You may be aware of that. But there are, yes, candidate tests and so on that are out there, and we'd be interested in exploring the potential value of any of those through the mechanism I mentioned. Did you want to come back to the contact tracing?
Just to say that, excuse me, internationally, they've estimated that there's an average of 36 close contacts per confirmed case of COVID. That's been the experience to date. And for it to be effective, for contact tracing to be effective, we need to contact between 70 and 80% of contacts of each confirmed case. So we don't have data on our experience here per case yet, but that will be forthcoming.
Excuse me, Tony, for the people who are watching who say, and they're not in your position, they're not the chief medical officer, but they're saying, I don't know why they don't just lock the country down, right? What do you say to that as an answer? And also, is it for you unconscionable, because some people would say that the medics would have to advise politicians on that. Is it for you unconscionable that you would recommend locking the country down, or could there be a point where you say we do need to lock the country down like other countries have done?
I don't think I could have ever envisaged just providing the kind of advice we've already provided to government around what needs to happen to respond to this disease. So there's no reluctance, fear, reticence on our part to advise in relation to things that we think are necessary. I've heard a lot and read a lot about lockdown and things of that nature. That's not what we're recommending. It's hard to know what a definition of lockdown might be. What we're saying is we've got a package of measures, first and foremost focused around individuals in terms of their own individual behaviours and respiratory etiquette and hand washing and social distancing, and for individuals to take that personal responsibility, and then complemented by a series of different measures that have been taken in relation to mostly social distancing that has involved the closing schools and mass gatherings and workplace recommendations and so on. And those are significant. And what we're saying to people is we need people to follow we need most of the people, the vast majority of the people, to follow most of the recommendations most of the time. We think that that's a reasonable response. If we were to say we want every person to follow every measure all of the time, that would be lockdown. I mean, it would be easy for somebody in my position to recommend that every airport close, every port close, every piece of public transport close, every workplace close, every other setting in which people interact close, every part of society and the economy close. And that might reduce the level of transmission of a virus. But it would be a very disproportionate measure in relation to so we have to remain proportionate in terms of the measures that we think are appropriate. And so what we've done now is made recommendations available to government towards the end of last week, which have had a very significant social and economic impact. We recognise that would happen, and we didn't make them lightly. And in that context, we think that's a proportionate measure in terms of the scale of what we might be faced were we to not implement measures of that nature. But full-scale lockdown, or how people perceive that, and forcibly stopping movement and things like that, we think would be a disproportionate response at this point in relation to our experience of the disease, our assessment of where we think we are, and the measures that we think we need to take in response to that.
Dr. Hoolan, just one point on social distancing. The government's COVID-19 action plan published this evening, it's advised, as you know, that people be at least 3 feet and ideally 6 feet between themselves and others. Can I ask that this apply to this briefing ongoing in everyone's interests as we proceed in the future, please?
Yeah, absolutely, and we'll continue to try to ensure that that's the case and to facilitate in as much as possible you being safe and us being safe in terms of our interactions. There are a number of other things that we need to be cognizant of, and that applies to meetings and workplaces and all of that in the ways that we have described to you. The duration of events is also a factor. So people spend time in indoor environments, spending time in meetings that go on for more than 2 hours, irrespective of the level of distancing between individuals. So it's not just about the space between people, it's the length of time and the nature of contact that takes place within those places.
Could I add, Fergal, it is a matter of personal responsibility too. For anybody attending a meeting, it's their responsibility to act on these recommendations and not be told.
Dr. Holland, realistically, are we looking at this new normal stretching on into next year significantly, given while the virus may be slowed, were the restrictions to drop, surely it would just start to spread like wildfire once more? So
we're expecting the current situation to last for a significant period of time. It's difficult to put a period of time on that. Some of the questions that you're asking there, the world doesn't fully know or understand what is the impact of removing the restrictions after the successful containment or whatever. So, for example, in China, while restrictions are still in place, they've seen a substantial reduction in the number of cases. They haven't yet lifted restrictions. What will be the experience in that country and in other countries when they begin to relax some of those restrictions? That's something that's not yet known. What's not yet known will be what the impact on populations that achieve 50-60% levels of clinical infection. Is the rest of the population immune? What's the level of what we call seroconversion? In other words, a person having antibodies because they've been in contact with the virus but haven't developed symptoms. What percentage of the population has that experience? All of these things go into the question of the likelihood of second waves and so on. So the kind of experience that we have with flu, for example, with H1N1, which is the swine flu virus, appeared for the first time in the world in 2009, occurred in a significant wave and further waves, and is now part of the background seasonal flu every year, and it's part of our experience. Will this happen with this particular virus? The world doesn't know yet. So it's difficult to project as to what will be the situation into next year at this point.
Dr. Glynn, maybe I could ask you, just on the number of cases that are confirmed tonight, we have been given a breakdown on if they have been community transmissioned, if they're associated with travel, or if they're associated with people that they have been in contact with someone that has COVID-19. Can you break that down for us tonight?
So as we've said, our intention later this week is to provide a much more detailed report than we've been providing over the last number of days. And that will include that data as well as the county data, the age data. But that's to come later this week and will be given on a weekly basis.
Is there any indication that we are seeing health workers getting infected that are in contact with COVID-19 patients?
Some of the contact tracing, certainly for some of the primary cases, has shown that certain healthcare workers in certain settings are exposed, and hence our advice and our support for healthcare workers through the provision of protective equipment. So, as Ronan says, we'll have a final surveillance report at the end of the week, which we update weekly to show a breakdown in terms of not just age and geography, but gender and profession and so on. No, this is obviously with the first imported cases that came in. So, but as of now, we have provided, sourced, provided, and procured extensive amounts of PPE for our staff in these positions, and we've issued directives and advice to staff in all healthcare settings as to when and where this PPE should be used and when it should not be used, so we can use this valuable resource for when it's needed.
So one of the things just to point out in relation to this, one of the changes we made in the way we report to you, and we said this to you previously, is that we were reporting to you on a comprehensive basis each day, all of the cases diagnosed in that day, and often it meant we were doing press briefings with you at this hour of the evening, 8:30, 9 o'clock in the evening, and we changed that to give you an earlier press briefing, but also to try to be as up to date as possible and say this is the total number of cases as of lunchtime today. The reality is that the number of cases that we're having on a day-to-day basis then makes it difficult to give you a comprehensive breakdown in relation to some of those kinds of questions, because the number of interviews that are required and so on in that length of time. So as we move to a situation where we give you more comprehensive information, which we want, it won't be as real time. So we won't be able to give you something that's at lunchtime at 5 o'clock with the kind of detail you're looking for, which is part of the reason that we're not giving that to you this evening. We will, as we move into giving you more comprehensive update, do something that's, let's say, of an evening, giving you the most up-to-date position for all the cases of the previous evening, if that makes sense.
Dr. Hoolan, excuse me, Ireland is faring quite well in terms of the number of fatalities when compared to other European countries. Can you comment on that? And do you expect the number of fatalities to? Do you expect Ireland to reach a period where there will be a number of rapid fatalities?
So we expect the number of cases overall to increase. We expect to see in broad terms a pattern of severity in relation to that matches the pattern that we've seen in many other countries. And so unfortunately we do expect to see fatalities in relation to that occurring. It's too early for us to say, while we've reported 2 fatalities unfortunately, to say whether that represents a lower proportion, or it's just the numbers are simply too small to draw any extrapolations from that, or indeed to take any comfort from it at this point in time. We do expect to see the number of cases increase, the number of hospitalizations increase, the number of ICU admissions increase, and some fatalities will occur. But it's important for me to take the opportunity to re-emphasise that for the majority of people, this will be a mild self-limiting illness, quite limited number of symptoms, and that will resolve by itself, and in over 80% of cases we expect that to be the case. That's particularly so among young and healthy people, younger and healthy people, and so we know that this is an illness for vulnerable people, and we've identified some of the groups, either people who are older or people who have underlying medical conditions and so on. They're at greater risk in relation to some of the more significant symptoms. So it's a milder disease for the majority of people, but the projections that we're making in terms of numbers of cases and numbers of hospitalizations and deaths does mean that in fact we will see deaths increasing like other countries have seen.